Hello everyone. Today we'll be talking about antepartum hemorrhage, specifically abruptio placenta. So definition, this refers to premature separation of a normally situated placenta before delivery of the fetus. Recognized associations are preeclampsia, eclampsia, polyhydramnios, grand multiparity, low socioeconomic status, smoking. So what are the types of abruptio placenta? We have revealed, concealed, and mixed. What are the clinical presentations of abruptio placenta? Painful pervaginal bleeding, passage of dark blood with clots, loss of fetal movements, and it may be provoked by trauma, so there may be history of trauma. Woman is usually in shock. Uterus is tense or irritable. Apparent large for dead fetus. Difficult to palpate fetal parts. Absence of fetal heart. So what is the immediate management of abruptio placenta? Admit the patient, call for help, establish IV access, cross-match blood, hemoglobin check, bedside clotting test, check the vitals. If shock is present, manage shock. Now what is the subsequent management? Management of shock, aim for delivery preferably by vaginal route, artificial rupture of membranes and augmentation of labor, then provide adequate analgesia, anticipate postpartum hemorrhage. So what are the complications of abruptio placenta? Disseminated intravascular coagulation, renal failure, postpartum hemorrhage. What are the local causes? Do a speculum examination after exclusion of placenta previa. So on conclusion, antepartum hemorrhage is an obstetric emergency. So under antepartum hemorrhage, another important topic is placenta previa, for which I've also made a video. So if you're interested, you can watch that as well. If you like the video, please like, comment, subscribe. Thank you.